The Lifestyle Show.
Today we wanted to really have a chance to understand about bacterial infections. There are a lot of, we call, as long as someone says a bacterial infection, we don't know whether it is a sexual but infection, an STI, a UTI. And so we're wondering, which bacteria do I have?
Actually, let me even engage you on this note, doctor. I think I'll have clear explanation from you.
Yes.
I was telling you off air. The times when I was growing up, I'm not so old.
Chokera like that, you're old.
There was a miaka 2006, 2005,
Yes.
2003. There were times of malaria, and malaria was the big issue, especially amongst growing children.
Yes.
And probably teenagers. And then that generation was defined by tabs like chloroquine, drugs like quinine. And I think we used to have those clinical thermometers that had a particular shape.
Yes.
We used to put under the armpit and all that. I mean, I feel like every generation is seemingly shifting with its own problems when it comes to illnesses.
Yes.
And I feel like this generation is a generation of bacterial infections.
Yes.
I don't know if they were not there then, but when you're going to define it, is it about the health and lifestyle behavior, all that? And also,
Yes.
it has come to, I think, people's heads that every hospital they walk to, the doctor will tell them you have a bacterial infection.
Yes.
For everything is going to be defined as bacterial infection. I want us to really have this discussion.
Okay.
Why is it that they are on a rise? And also, the forever treatment. Someone is having a cannula. Almost every month they're treating an infection. And trust me, every time they go back to the hospital, you have an infection. So that's going to inform the conversation of today. We want to answer some of those questions.
Okay.
But again, we hijacked you. You need to introduce yourself.
Okay, thank you, Mr. So, Dr. Ainebyona is my name, and I really treat well infections, as you've earlier said. So, bacterial infection is the commonest word among all facilities almost. I know most patients are even tired of the word when they reach in the hospital. They obviously will tell me it's a bacterial infection. Bacterial infection, there are two words, bacteria and infection. So bacteria is a microorganism which is found everywhere in the earth, including in our bodies. In fact, the bacterial cells within our body are more than our body cells. Yes. Then the word infection is when the bacteria have access to our body and it is capable of causing illness. Now, when we combine the two, it becomes a bacterial infection. So by the time a bacterial infection is now, it becomes a disease because it has access to our body tissues, and we are now having signs and symptoms of it. That is temperature, fever, chills, body weakness, fatigue. That is when the bacteria has access to our body and is causing now a disease. Yes, you had talked about generational diseases, like, for example, you were talking about malaria being the commonest in those years of 2000 and so on.
2, 3, 4, 5.
Yeah. Basically, for malaria, by then, people had little information about malaria. Even the treatments of malaria were still ordinary or limited compared to now. So after that, medical reports and so on that malaria is too much. You know, remember those days they used even to find, even in the deep villages, we used to have TV. They bring broadcast TV showing us how malaria spreads to an individual, which is not done now. Because people got sensitized about the malaria, the treatments were revised and improved. We have, the other time we used to have quinine and chloroquine. Now we have a lot of drugs which treat malaria and which clear it at a higher rate of even 2 doses are enough for a patient to quickly improve. So also bacteria is taking an advantage that because people have little information about it, how
That's
it is
true.
spread. And of course, in a lifestyle changes of nowadays, people have weaker immunities compared to the past. So that one is also another factor why bacteria infection has taken an advantage of that. And I had already told you that our body contains bacterial cells more than what the body cells. Meaning, in case the immunity is weakened, the bacteria has a chance to now start becoming a disease.
Clearly understood. I think one of the biggest questions that every listener has out there
yes, mister.
is one, every time they go to a hospital, they are told bacterial infection. And now, it's not even about the hospital, but the ones they tell about.
Yes.
It is a common narrative that when Joan comes to me and she tells me she has a bacterial infection, my mind's inevitably they're going to go to a UTI or an STI.
No.
You understand?
No. It shouldn't be like
again,
that.
I understand. Joan, that look, I love it. Thank you.
You shouldn't have used my name, but it's okay.
But again, on a serious note, I want to believe the little knowledge I have, there are respiratory infections, skin, and all that. Can you help a listener out there to break down the different bacterial infections that are out there?
Yeah, so bacterial infection is actually a complex word because the bacterial infections are actually categorized depending on the part being affected. That is one way, that is how you are, the version you are bringing in. But there are also other how we can categorize bacterial infections. Sometimes depending on the exact causative. For example, do you know typhoid is also a bacterial infection? But we normally call it typhoid because what causes it is a type of bacteria called the Salmonella typhi. So depending on the system or the organ where the infection is attacking, we normally categorize them in that way. That is, for example, if we say urinary tract infection, which is a bacteria type, is affecting the urinary system.
Okay.
If we talk about respiratory tract infections, which is bacteria, we are talking about that bacteria is attacking the respiratory system. So they go to the name depending on the part they are affecting. So when someone says he has a bacterial infection, sometimes we go ahead and specify which part is getting affected. So if it was urinary tract system, we can say this is a urinary tract infection because it is affecting that part.
Okay.
Yes.
So that answers you, Dave. That answers you who wanted to think about. But also maybe in the hospitals, they should be doing that. They're not just saying it, bacterial infection. They are making it, they're giving the word to someone who has not studied sciences.
Yes.
Or who was asleep the time for sciences. So for us, it's just bacterial infection. So, and the fact that they have always accorded it to UTIs and STIs, that's the bacteria that we know about. So thank you for specifying that to us. But also to ask you, why is it that it is always recurring all the time? Someone is treating today, another again next month. Why is it that it is recurring?
Yeah, thank you, Madam Joan. The factors are really very many. Why the bacterial infection can be occurring. But I will break like one or two. One is poor treatment.
Oh.
You find maybe the treatment they are using to treat the bacterial infection is not strong enough to clear the bacteria. That is one reason. As I had told you that bacteria are found everywhere. Sometimes you find the source of bacteria has not been cleared. We treat this one, it clears, and you go ahead and, for example, if you are taking contaminated water and you come and we treat, then again you remain taking the same water, definitely the infection is coming, it will come back. Then there is weakened immunities. You find most people have immunity which cannot support itself. So you find even if we treat, bacterial infection can come again. And there is other infections, for example, HIV. So you find the patient is having other underlying infections whereby now bacterial infection takes an advantage of that.
Okay.
Because the body's immunity is already weakened by the other infection. And for bacteria, is just taking an advantage of that. So there are very many. Then there is what we call drug or antibiotic resistance. Most of antibiotics are now becoming resistant to kill bacteria, and also factors are very many. Because, for example, this self-medication of most patients. Patient, because they have now some information, he feels itching, he says, I know. One day doctor gave me this medicine. He can even go and buy, or he asks a friend, or he looks Google, because Google, they Google the drug, and you find they are treating the wrong thing. They are not getting the appropriate antibiotic which should be applied there. And eventually the bacteria also learn how to escape the treatment because it has been exposed to it, but the way how it is exposed, the drug is not strong enough to kill it. Now the bacteria will also get methods of how to escape the drug from clearing it. So that is actually the most...
Doctor, you're saying bacteria yes, yes.